First, let's welcome Dr. Ted Parcel of Novant Health Orthopedics and Sports Medicine. Welcome to the show today, Dr. Parcel.
Thank you. Thanks for having me.
It's great to have you back. I know you were with us not long ago, but there may be some folks out there that didn't see that show the first time. So how about reminding us a little bit about your background and your education?
Sure. I'm initially from Pennsylvania. I did all my education in Pennsylvania prior to my hip and knee training down in Tampa, Florida, where we specialized in hip and knee replacements.
You have a fellowship in hip and knee?
Yes, that was an extra year training after the completion of my residency where I went down to Florida, and we did several hundred hip and knee replacements that year, from simple to very complex problems that were referred in from far away.
Wow. I guess from the demographic down there, there's a lot of hips and knee needs.
Most certainly. It was a great place to train because of all the retirees, and you had many transplants from the Northeast and such that were down there, and we took care of quite a large number of patients that year we were there.
So let's talk about your clinic. Now, I understand it's called Novant Health Orthopedics and Sports Medicine.
Yes, we're located in Supply, North Carolina, just a couple miles south of the hospital in Bolivia. And there we're able to take care of all our patients' orthopedic needs. And I like to specialize in hip and knee replacements.
And I understand you I know that you're fellowship trained, but it says hip and knee reconstruction. So explain that.
Yes. It's more of a fancy way of saying hip and knee replacement.
Okay.
But it involves simple problems, from just taking care of injections and other non-operative things to arthroscopy and simple surgeries, and then also gets into more of joint replacements, from the simple first-time joint replacement surgery to the ones that have had several surgeries that come in from places afar that may need additional treatment and care. And this involves both the hip and the knee.
So is it a little more difficult to take one out and put a new one in than it is to do a first time?
It is, and that was the advantage I had from doing that year in Florida, where I was able to gain that extra expertise, and I've been in practice now for 10 years and have the experience of doing that on many occasions for the difficult problems that no longer now need to be sent out of town. I'm more than happy to take care of those here locally.
I guess joints don't last forever, is that correct?
They don't. The old rule of thumb that people tend to hang their hat on is 10 or 15 years. That is not necessarily the case any longer. Our implants have evolved and improved where they're more durable and they're lasting many more years, which allows us to intervene on some of our younger patients. The old school of thought is, okay, we need to wait till patients are in their late 60s, 70s, 80s before we do anything, but now we can do joint replacements on patients much younger as the implants are lasting a lot longer.
So say I'm having knee pain and I'm taking ibuprofen and I'm just over it. I want to do something. So I'm going to see an orthopedic surgeon such as yourself. So when do I seek that medical advice? How long do I put up with this?
We're happy to see people at any time. Some people are just having some knee pain and are concerned, and I'm be glad to evaluate those patients. And I've had some patients with multiple surgeries before that come in to be evaluated. And we can initiate treatment from just having a discussion and educating the patient to medications, perhaps injections or bracing and therapy. And lastly, we would consider surgery if some of the non-operative things have failed.
So you don't jump into surgery right away. There
Most
are
certainly.
other options.
Absolutely.
You start.
I find myself to be a little bit more conservative. I don't jump right to surgery. I think it's important to try some of those non-operative things because a lot of times they actually work. I've had patients I've treated for years with injections, and I'm happy to see those patients regularly and take care of them. And when things stop working, we can take a new direction.
How about physical therapy?
Physical therapy can be beneficial in certain patients depending on their condition, but it can help patients to kind of also get to know what they need to do more on their own at home to help their overall level of fitness and their quality of life.
Well, how common is the need for a knee replacement?
Knee replacements are quite common. The latest numbers we're seeing are about 1 million knee replacements are done in the U.S. Last year.
Really?
So they're extremely common, and what we're seeing now, even since I was a resident where patients were in the hospital 3 or 4 days, and now knee replacements are being done as an outpatient in a lot of centers, or just a simple one-night stay and are home within 24 hours. And that's allowed us to take care of more patients, and we know how to handle these patients better in terms of the medications and anesthesia and everything else to get them back up on their feet and back at it much quicker than we used to.
So we've determined that I need a knee replacement. So what can I expect?
Sure. In the office, I'll talk with the patient. I will go over their x-rays, and discuss with them so they can see and actually understand what's going on. And I'll let them get their hands on the implants and see what they are so they actually have an understanding of what they're getting into instead of just a picture.
Yeah.
And also I want to describe the patient that, surgery is not without risk. We'll discuss all that and be upfront and honest with that, but also discuss expectations, what you will see in the hospital, how you're going to feel, what medications will be used, and what the subsequent weeks are after surgery, and what needs you may have at home, therapy, equipment,
There's
etc.
a lot.
It's a process, but in the end, it works quite well, and patients are very happy.
What's a typical recovery time for knee replacement?
Sure. As mentioned, most patients are in the hospital at night, occasionally a second night. We like to get most everybody home. The fallacy of going to, quote, rehab is not necessarily the case. Patients do better at home. The results are better with less issues. Therapy takes place about 3 days a week with a formal therapist, but therapy is important to be done by the patient on a daily basis, several times a day on their own. So they're responsible to take, some of that care themselves.
How long do you have to be in therapy?
It depends on how well patients progress. Sometimes it's 4 weeks, sometimes it's 6, but 6 weeks is about the average.
Okay.
And then patients need to continue, with their exercises and strengthening for a while thereafter to get the best result possible.
Yeah. So what do your patients say to you after they've had knee surgery? They've been dealing with this for a long time.
Sure. What I've found to be most beneficial is help patients' expectations up front. Give them all the education they need prior to jumping into surgery so they're not taken by surprise. They're not, oh, you never told me. No, I'll spend the time so they understand all they're getting into. But then once they've come through the surgery and the therapy, so many patients are so happy to get back to all the things they want to do.
They can do what they...
And down here, you get the patients back on the golf course and out on the beach and their boats and out in the yard. And I've had patients do highly active things through the years, including police officers.
Really?
And when I was in a former position, I had a patient who was a mechanic for one of the NASCAR teams, and he had bilateral knees in and was back to working, doing well. He loved it.
If somebody's out there and they're experiencing knee pain, how's the best way to get hold of you? What should
they can gladly call our office, and our staff will try to work them in as soon as they can be seen.
Do you take appointments online?
We do, and if patients would like to visit the website, they can help choose their own appointment time that way as well.
And do they need a referral?
Depending on their insurance, some patients may, but a lot of insurances do not require referrals to see specialists any longer.
Great. Well, we've run out of time, but I can't wait to have you back because we did talk about hips today. So that's our next talk.
We'll save that for next time.
Okay, great. Thanks again for being here.
Thanks so much. We'll see you soon.
You're quite welcome.